In our last story this hour, concerns of the spread of Ebola are escalating, with the death toll at over 4,500. An announcement by the World Health Organization that the outbreak of the deadly disease ended in Senegal may have been good news, but an internal memo from the WHO has exposed mismanagement that has apparently contributed to the spread of the disease in West Africa.
The death toll from the Ebola virus in West Africa is increasing, and concerns are already rising about whether the international community is properly handling the situation. US President Barack Obama has announced that implementing a travel ban on West Africa may not help much in stopping the spread of the disease.
If we institute a travel ban instead of the protocols that we put in place now, history shows that there is a likelihood of increased avoidance. People do not readily disclose their information. They may engage in something called broken travel, essentially breaking up their trip so that they can hide the fact that there's a disease in place. And as a result, we may end up getting less information about who has the disease. They're less likely to get treated properly, screened properly, quarantined properly. And as a consequence, we could end up having more cases rather than less.
Positive signs appeared on Friday, increasing hopes that Ebola could be finally brought under control. The World Health Organization said the outbreak of the deadly disease in Senegal is officially over. It says the only case that had been identified in the country has fully recovered. But the same organization, through an internal document, has admitted to botched attempts to stop the killer disease in West Africa. The organization says several factors, including incompetent staff and a lack of information about the spread of the disease, had caused its outbreak in West Africa. The draft document has highlighted several points that would undoubtedly put a black mark on the organization's performance, with a heavy cost for human lives. This has now raised serious concerns over the capability of the organization in dealing with public health problems. The United States and several of its allies have already started a self-declared battle against Ebola and devised serious plans to stop the killer disease in its African hotbed with the help of its military. It appears that Washington has accepted responsibility for a mission which falls within the authorities of other world bodies like WHO. But what has motivated the US to do so is a question that still remains unanswered.